Hello everyone, I'm Ankit and you're watching StudyIQ IAS English channel. Now, medical conditions and physical fitness of popular political leaders are always under speculation, especially if that political leader is over and above 60 years of age. And in this regard, US President Donald Trump is no different. Because regardless of what he claims about his physical fitness, he is still a 79-year-old senior citizen. So in recent times, when people saw visible signs of bruises and swelling that appeared on his hands, it created a lot of buzz and speculation over his medical condition. So in this regard, let us try to understand what is the medical condition US President is suffering from, what may be the common known symptoms, treatment methods, etc., which will be important from our exams perspective. Now, in our today's video, we'll find out that the US President Donald Trump is suffering from a medical condition known as chronic venous insufficiency. This is a medical condition that basically affects the flow of your blood through your veins. Now, normally blood vessels are categorized into two different types. The first one are known as arteries. These are the blood vessels that take oxygenated blood away from your heart, right? And the other kind of blood vessels, these are known as veins. And veins, what they do is they bring deoxygenated blood into your heart, right? So this is the difference. Artery basically takes oxygenated blood away from your heart. Veins, they bring deoxygenated blood into your heart, right? So this chronic venous insufficiency, as the name suggests, it deals with flow of blood not through arteries but through veins, right? Now, what happens in CVI, that is the abbreviation for chronic venous insufficiency, is that the veins that are present in your legs, they actually fail to pump the blood back to your heart quite efficiently. Now, normally what happens is that the valves that are there in your veins, they ensure one-way flow of blood towards the heart, right? So in CVI, what happens is that the valves in your blood vessels became weakened or even faulty, and this allows blood to flow in an opposite direction, that is backward, and sometimes it can even lead to pool of deoxygenated blood away from your heart and into your legs, right? So though it is not a very life-threatening conditions, but in reality it can lead to appearing of symptoms like pain, swelling, leg cramps, skin discoloration, varicose veins, and even can lead to leg ulcers, right? So what are the symptoms of venous insufficiency? You can take a look from this diagram. It says swelling can appear in your legs. You can feel pain and heaviness. You can feel leg cramps or spasm. You can feel restless leg syndrome. So these are the visible signs of venous insufficiency. Now, what kind of people are at risk from suffering this kind of a medical condition known as CVI? Now, the individuals who are more likely to develop CVI, you need to understand they might be overweight, they might be women who are pregnant with a child, or they may even have a family history of venous issue. And people, they are also at risk of this kind of a medical condition if they have suffered from leg injuries in recent times, they have undergone leg surgeries, or have even experienced blood clots. Now, CVI, what you need to understand, it is very common in older adults, especially the ones who are older, progressively of an older age, and it actually impacts persons who are approximately at the ratio of 1:20. So out of every 20 older adult, there's a possibility that one adult might develop this kind of a condition, which unfortunately the US President has also developed. Now, in this regard, let us discuss what are the treatment options to deal with CVI. As you can understand, one of the key causes that leads to CVI is overweight. So you need to understand lifestyle changes can be the first line of action. First of all, person who might have CVI, they might be encouraged to participate in a regular physical activity. They might even require to elevate their legs for a prolonged time and might even absorb or try to do weight control. Similarly, there are certain medical therapies also involved that may lead to quick recovery of the patients. First of all, medications are provided that can improve the blood flow. Similarly, compression therapy that includes use of tight stockings and bandages might be employed, which might be needed to support the veins. And in certain cases, if this goes out of hand, even surgical procedures may be considered. So these are the relevant symptoms, these are the conditions, these are the at-risk people and the treatment options that are relevant from the chronic venous insufficiency disease, right? So let us try to solve a practice question so that we know we have understood this topic quite and well. And before that, I needed to convey something to you, especially for the students who are looking to give exams later on. So we have long-term batches for you, especially for 27 and 28, right? So this goes quite well for students who are currently in college or the working professionals, because they can't give 24 hours of your time for your UPSC exam preparation, right? So for you, the best option is to take a long-term batch, because in long-term batch, we teach you all the subjects, but we take a longer amount of time. So this will provide you adequate time that you can give to your professional and educational responsibility, and will leave out sufficient time for you to prepare for this exam well, right? We have batches for 27 and 28. You can still take admissions to these batches, but please ensure you need to apply the code ATS Live, because it helps you save 7,000 rupees on all the courses that are available on our platform. Now this admission for 2028 batch is closing on 31st of July, so you can please hurry up. And if you have any doubts, if you have any queries, please do not hesitate us to call. We have a number 9240231070. You can call on this number and get every of your query resolved. But please remember, before making the payment, do not forget to use the code ATS Live, because it helps you get a lot of discount, right? Now let us come back to the practice question that I've curated. With reference to chronic venous insufficiency, consider the following statements, and you have to identify which of the following statements is or are correct. Do let me know the correct answers in the comment section, and the ones who answer it correctly, I'll give your comments a thumbs up, right? And if you want to download the notes, these notes will be available on a particular Telegram channel known as ATS Live. So you can search the words ATS Live in the Telegram channel. Alternatively, you can also scan this QR code and it will help you locate the channel. Subscribe to it if you still haven't, and you can download the notes. So this is all from my side. Please have a very good day.